Well, I want to welcome all of you to our event today, which is how misinformation and history affect BIPOC trust in the COVID vaccine. My name is Nora Benavidez. I work at PEN America and work very closely on issues affecting communities as misinformation permeates our news feeds. Today, I am joined by a wonderful, esteemed panel to begin to dive into the issues of history, misinformation, and of course, the immunization process. It feels like, whether it is election and political misinformation, misinformation and the kinds of gulfs between us as friends and family members, these are the issues that present existential questions. And, when it is life and death matters, the question of do I get vaccinated or do I not? PEN America felt like we needed to weigh in and bring a set of experts together. And so I'm thrilled that our amazing colleague, Anoa Changa, who is a journalist and ally of PEN America's, has been working with me now for the last month to consider the contours of this problem. We've both had personal experiences with friends and family members talking to us, sometimes falling prey to misleading information and rumors. And of course, we've also then seen it in our work at PEN America and how intractable sometimes it feels when people present conspiracy theories, sometimes just being misinformed, uneducated about the vaccine. Above all of this, I think that Black, Latino, Native American, and other people of color are being uniquely and more aggressively targeted with misinformation, often left more vulnerable to and lacking access to the kinds of credible information we need. And so it is with that in mind that we've created this event. We hope this is the beginning of a larger conversation where we can bring experts together more regularly. But I want to welcome all of you. I want to give it a huge hand and round of applause to Anoa Changa, who will be moderating our event. And she will be introducing our wonderful panelists now. So Anoa, thank you so much for being here.
Well, thank you so much for inviting me along for this conversation this morning, and greetings, good afternoon, good morning to everyone who is joining us from wherever you are joining us. I'm really honored to get to moderate and be in conversation with Dr. Carrasquillo, and I'll let each introduce themselves properly, and as well as Jacqueline Mason. So Dr. Carrasquillo, I will turn it over to you for introductions.
Thank you, Noah, and thank you, PEN, for doing this great event. As you heard, I'm Olveen Carrasquillo. I'm the Chief of General Internal Medicine here at the University of Miami. And a lot of my work, aside from taking care of patients, has been in research in my minority health and health disparities. And when this COVID epidemic came on, I stopped everything else, and I've been working on COVID research, including some of the COVID vaccine trials, but a lot of other studies, and a lot of other studies as well. In terms of COVID. And now our concern has been around a lot of the misinformation, miscommunication. So now we're leading a big statewide initiative to address these issues. So thank you for having me. It's my honor to be here.
And thank you so much again for joining us. And next is Jacqueline Mason.
Thank you, Anoa, and thank you, PEN America, for having me. My name is Jacqueline Mason. I am Senior Investigative Researcher and Special Projects Manager at First Draft. First Draft is a global nonprofit that seeks to fight misinformation and disinformation in different communities. I currently work within a collective called the Disinfo Defense League. It's 200 grassroots organizations in which we fight racialized disinformation aimed at Black and Latinx communities. So basically, we've moved on from the 2020 election into some more pressing issues such as immigration, also how COVID vaccines affect immigration and COVID vaccines in general.
Excellent. And so, when we have been thinking about this conversation, there's been a lot of conversation in the past couple of months in particular, as vaccine rollout has been ramping up across multiple states, about misinformation, but also about the concerns that predominantly Black and other communities of color have with getting this vaccination, right? We've seen various stories about people's skepticism, about concerns. And again, they're grounded in some very real issues that have happened in our past. But I was just wondering if we can just just step back for a second and just talk about why this is even an important conversation to have as we're in the middle of a public health crisis, still almost a year into this. Dr. Carrasquillo, I'll start with you. Why is it important for us to step back and really talk about some of the concerns and issues around COVID misinformation, around the vaccine, and recognizing that some of the historical mistrusts that exists within our communities?
Yeah. I mean, for me, it's very personal. I do most of my work is around improving access to healthcare to minority and other vulnerable communities. And when we saw COVID, I mean, a lot of us that have done work in this area, we knew who was going to hit hardest. It's like any other major tragedy somehow seems to affect minorities hardest. With COVID, we knew the reasons. We're essential workers. We live in more crowded settings, more segregated, more multi-generational households. We also suffer from some of the health conditions. And sure enough, COVID hit minority communities. When you see the rates, rates 2 to 3 times harder in COVID at all minority groups, obviously Blacks, Latinos, and Native Americans. So you saw that disparity happening in COVID. And so we were really hopeful when the vaccines came out. And then we started getting a lot of data about misinformation and miscommunication around the vaccine. And that's what really got us to think about it. And people do have, some evidence. We know about a lot of historical abuses. The Africans and Americans know full well about the Tuskegee experiment. There's also, Henrietta Lacks and how her cells were used without permission of family not getting. But every community, if you talk to Native Americans, they have a whole list of medical abuses that they have. I'm from Puerto Rico, and we know about the forced sterilization campaigns of the 1960s. So, people have a lot, and certainly the last year and what's happened in politics the last year gave us a lot of reason to have concerns. And so, makes us frightened and worried about anything that happens. But when I see what COVID did to our communities, and I see the way that we can get out of this crisis, it makes us really imperative that we act and do something. And that's what concerns me about the miscommunication.
Thank you so much, Jacqueline.
Yes, I really agree with Dr. Carrasquillo on many aspects of that. Being a researcher in mis and disinformation and watching the election, mis and disinformation proliferate, as soon as Moderna and Pfizer announced, the vaccines were coming out, immediately my mind went to, if it's anything like what we saw with the election, we are going to have a long haul in front of us as far as getting vaccine trust out to our communities, right? We knew from our COVID monitoring in the beginning of the year that Black and Latinx people were more likely to die from COVID than other communities. So getting a vaccine to these different communities was so very imperative. So we did not want to have this kind of misinformation really influencing people and having them to have, be scared, have hesitancy from the vaccine. Yes, of course, there's historical legacies that we'll get into, such as Tuskegee, that's from the past, but we also have current things. We also have the hysterectomies in ICE facilities that were happening. We also have the fact that Black women are more likely to die from medical malpractice and in childbirth, right? So people going to the doctor and being turned away because of their skin color. So there's a lot of reasons to resent and maybe not trust medical health professionals and the medical health system, right? So this is just a really imperative conversation that I'm glad we're having.
Yeah, I really appreciate both of you in helping to ground us in this context, because just thinking about how we're launching in or walking into this conversation, right? We talk about, or in the media, we see a lot of it framed as hesitancy and mistrust, but that trust aspect, you both just gave several really meaningful examples of why there is a lack of trust. What does it look like to help, or at least bridge the gaps or the lack of trust for various communities to help them be more receptive or understanding of the importance of the vaccination? Dr. Carrasquillo, I'll start with you.
Yeah, so a lot of our work is, we found you have to work with the local community leaders and the local community partners. Everything we're finding out about misinformation and mistrust is not monolithic. Every community has something else and a certain fear or something else that's spread. So we're working in Little Haiti. We've been working a lot with the Haitian community leaders, the Haitian pastors and other faith leaders of the Haitian community, for example. So in every community, you got to find who are the trusted people, what are the sources of information they trust, and work through them. So a lot of that. We've also found for a lot of minority communities, they trust the minority doctors and minority scientists, and many of us have been working on this. we know Dr. Corbett, for example, African-American, she's the one that really developed the Moderna vaccine, for example. And so we know, and so we've been doing a lot, we feel that as healthcare professionals, people tend to trust us more. So we've been doing it, but it's really working at the community level, at the grassroots level with the local partners. That's what's going to address this communication and mistrust.
Thank you. Jacqueline.
Yeah, I agree. Essentially, working with the grassroots organizations that we work with at First Draft, it's very important to talk to and work with community leaders in order to, strengthen that trust, right? If we're just talking on a basically anecdotal level, like with our loved ones, even with people within our community, it's really important. They might come to us with some sort of vaccine misinformation, and it's very easy to shame someone or make someone feel less than smart for, saying what they have viewed, right? But we know how the internet works. We know how Facebook works. These videos, they can be very professional. They can be very seeming like science and fact. So it's easy to slip into that hole, right? So if we know the truth, right, or we know they can get healthy information, it's important to, talk to them, right? At First Draft, we talk about something called emotional hesitancy, right? So if something is making you feel, when you watch these videos, you might feel scared for yourself, or you might feel angry that you are being targeted, right? So then it makes you more likely to spread harmful information. So we kind of tell people, okay, if you're feeling this way, like stop, think about where you're getting this information from, think about why the person might be spreading it, and let's have a conversation about, what is truthful and helpful.
Mm-hmm. And Jacqueline, you have a story I think you were sharing with us, if you want to share it a little earlier, about just kind of how this played out recently for you in real life.
Yes, I was getting my hair done, and my hairdresser was having some, trust issues with the vaccine, and one of her clients was actually getting a little bit upset about the conversation. She was a medical health professional, and she was trying to really come at her in a way that was just a little bit too, obviously, as a medical health professional, she knew the facts, right? And it was someone who was scared. So I tried in this role to mediate the conversation and say how they both could be right. You know what I mean? Like, yes, there is a reason for the way you're both feeling, but let's just have a conversation about what the vaccine is and the differences between what has happened in the past and right now. And it actually ended up going pretty well. The subject was changed because you can't go on those tangents too long. But yeah, I think it really helps to have these conversations and not having them online. Is better in person, or if you could make a phone call or a text, it's much better than having it on these platforms.
Mm-hmm, mm-hmm, mm-hmm. And I was just thinking about we keep having the conversation about hesitancy and mistrust, but is it helpful to just stop there and acknowledge the hesitancy or trust, or is there another step that we should be taking in having these conversations with people so that yes, we validate that there are valid reasons why people are hesitant and mistrustful, but at the same time, it just seems like we still need and I think Dr. Carrasquillo, this is what you were talking about when you talking about working with community organizations, both of you talked about this, like what are some of the things that we can say or do in the conversation to move past not ignoring or disregarding mistrust, but building beyond it and helping people start to see that there could be more to the conversation than just that feeling of mistrust.
I'll let Jackie start and then I'll add on.
Okay.
Well, I think that the thing about vaccine hesitancy is really that's kind of putting the onus on Black people to or people of color, BIPOC people, to accept that they're taking fault in the reason of having hesitancy when it's really more about trust. It's also about access. Something that we've also talked about is, we're not talking enough about access to healthy information and to vaccines. We're not talking about how different neighborhoods across the US have not been able to get access to a single vaccine. We haven't also talked about how some vaccine distribution centers are having very long lines in Black communities and Latinx communities. People want to take this vaccine, right? So it's very, in a lot of reporting, as we know, a lot of newsrooms lack some diversity. We're just kind of using go-to buzzwords of Tuskegee or of hesitancy without actually looking into the fact that lack of access is playing a huge part in why we are some of the most unvaccinated populations thus far in the rollout. So I think it's really important to get access conversations out there and get people the right sorts of information, as we saw with the Facebook ads, right? Black, Latinx, and Native people are not getting, the proper vaccine information from health authorities on these ads, right? So how do we start getting that information out there to people?
Absolutely.
And look, I will tell you, the rollout has been extremely problematic. And the first to tell you, I mean, we knew the vaccines were coming for several months and there were no plans to do this. On January 20th, we found out what we already knew, that there was no plan on how to deliver this, but it's been extremely problematic. And we've certainly seen, in our state, the governor said, give it to the hospitals, let them figure out with any plan. And the hospitals have never been involved in mass vaccinations. And each health system tried as best as we could, but it was stuff we had never done before. Things are getting better. And when you ever have a limited supply of something everyone wants, clearly you see disparities on where these places are happening. It's a limited supply. Obviously, here we have many examples in Florida about how certain very wealthy communities somehow were vaccinated very early on. So there's reasons to be distrustful. My job is to convince our community to get on those lines and get those vaccines while we address those logistical issues. I am hopeful now we have a third vaccine that the supply problems will be solved within the next 1 to 2 months. I'm very positive about that. And I think we'll get the logistics of the distribution much better so that they do reach our communities. And after that, then I think people have very good reasons to be hesitant about many of the things. And so that's who we want to talk to and, let them know. When you see the doctors and nurses in early December, we all ran to get the vaccines. When you see all the rich people yelling and wanting the vaccines right away, that, hopefully that's a wake up call to everybody. If you see, the healthcare professionals and the rich people wanting them, and my job is to make sure that it's equitable, because it's not being equitable right now.
I appreciate the way you all took this into the conversation around equity and access. I mean, we have seen, and yes, the rollout non-existent. I am based in Georgia, and I was just remarking earlier that it just seems like our governor keeps extending the very first category. We haven't moved beyond our 1A. He just keeps making sub 1A sections. And definitely everyone needs to get vaccinated, right? And just listening to the conversations with public health officials from the CDC, trying to make the decision on like, how do you prioritize one group over another? Like you hear people, if anyone who is a reporter actually took the time to listen to any of those discussions, you hear people really agonizing over how do we decide 75 plus versus 65? How do we decide about people with comorbidities? Like, do we acknowledge people who are frontline workers, essential workers? Like, how do we factor all these things in? So there have been a lot of difficult, challenging decisions being made, but this conversation about equity has to continue to be a part of all of that, because we have seen, unfortunately, in places like parts of New York, Washington Heights, rural communities, like all over the place, we have seen disparities where you have particular folks getting vaccinated in a particular zip code or community, but they're not actually of that community, right? Like it's not enough. I saw California is discussing some ways to allocate vaccination resources, vaccines to particular underserved, zip codes. But how do we make sure those set-asides are actually getting to the people who need them in those areas, and not just folks who are maybe more tech savvy and understand how to use the internet better? Because that's been a barrier too. I think Florida and several other states have relied on, being able to log in to an internet website that you would have to be hyper focused on social media or wherever else to know about, to be able to get the access to make those appointments. And so but that in of itself can also feed into some of the mistrust because of the haphazard ways. So I really do appreciate what you're both saying about how we need to continue having these conversations and taking the onus off of the whole personal responsibility thing when we have a whole system that unfortunately has been designed or not designed, right, to work at all is really, I think, a problematic experience, especially when we're thinking about how it's being reported out to communities about what is going on. So, just thinking about, and I think Dr. Carrasquillo, I've heard you say I've heard you use the term miscommunication as a part of this dialogue. Can you talk to me just a little bit more about what you mean when you're saying miscommunication, and whether or not that is like your own replacement for the word misinformation? And does the language we're using matter?
Yeah, I mean, I think it's both, right? I mean, I think the key thing for people to understand, whether it's just a matter of they're just getting the wrong information or whether it's just being conveyed improperly, I believe the central feature people to understand, most of us don't want to spread this stuff, right? We're very scared, we're very worried. And when you get something on Facebook, you see something on Twitter, let me send that off because I'm so scared. Oh my God, nobody knows that. So please think about where that information is coming from and if it's a trustworthy source. That's what I try to tell at least the people I talk to. Please hold on that, send all button or whatever it is that it's coming because, unfortunately, and I don't know where it's coming from, I see a lot of very, very professionally done, as you heard, people are actually coordinating miscommunication, misinformation campaigns. Some people say, oh, this is a bored high school student on a Sunday who's no, these are professionally done videos with people wearing white jackets who speak very medical terms, and they're all designed. And it just breaks my heart when I see them targeted at the minority communities because that's a lot of people, that's who they're targeting. And, it's very culturally appropriate. You see people that talk and look like us delivering these messages. They know exactly what are the inflection points of vulnerability and scared. And so, it's somebody's coordinating a very good campaign against our communities. And what I tell, I speak to people is please don't continue spreading that. Please don't hit that send. Think about who's sending it and if it's a reliable source. And so whatever you call it, it's an organized campaign targeting our communities. And that's what, our coalition is trying to fight.
Absolutely. Thank you. And then just a follow-up question that we just got in the chat. How do you think, and this is for either of you, or I can start with Jacqueline since you just spoke, Doctor, but how do you think about how this misinformation, miscommunication works or do you see it working hand in hand around the issue of vaccine trust?
Definitely. So I think what Dr. Carrasquillo was drawing on a little bit is the difference. People are spreading misinformation of disinformation agents, right? So they're spreading this stuff in good faith. Meanwhile, it was made in complete bad faith, right? So we look at some of these trends, like talking about Tuskegee, right? We have some of the overarching themes of calling the vaccine experimental, right? Saying the vaccine is contributing to depopulation, right? But using Tuskegee experiments, right, to call the vaccine then experimental. So like linking those two together and then talking about things such as guinea pigs, right? We're being preyed upon for depopulation. This is an attack on the Black community, right? So if you take, like we say at First Draft, every piece of mis or disinformation has a grain of truth in it, right? Did the Tuskegee experiments happen? Yes, they did. They are being misinterpreted throughout the internet ecosystem. However, that misinterpretation still has roots in truth and in reality, right? So that's going to make it a lot more potent to spread. We see things that come from organized disinformation agents online, such as Robert F. Kennedy, that then start to morph, and someone will say it to you, on the telephone, and they don't know where it came from because they're not listening to that information, but it still is a trickle down effect.
Absolutely. I mean, you just said RFK, Robert F. Kennedy Jr., for folks who may not be as well versed with social media or Twitter, when Hank Aaron died, the great baseball legend from here in Atlanta, Henry Aaron, died, he tweeted out that it had to do with the vaccine, that the vaccine was related to his cause of death when he was an elder gentleman in his mid to late 80s. And yes, he had taken the vaccine, but he also was an older person. And sometimes old people pass away because it's their time. And so there was literally no information put out by the family or anyone else that suggested anything had to do with it. But because RFK Jr. has a large platform, he was able to not only make that allegation, put that assertion out there, it spread because it's a large platform that people are looking to. And he already has his own stuff with vaccinations that he pushes or whatever. And this fit a very comfortable narrative for him. But this brings me to my next question for you all. What role do the social media platforms, or do the social media platforms play a role in making sure that good information is getting out there. We just saw, I think we had shared with us earlier, an article from the Markup that suggested that Black and I believe it's Native American and Middle Eastern communities actually have the lowest rate of receiving good information across the different platforms. You know, what role do the social media giants play in actually making sure that good information is actually getting through the various algorithms versus the way in which we see a lot of stuff that is not quite so great being shoved down our timelines? So either one of you.
Jackie,
No, Jacqueline, this is your jam.
You, yeah. That's not a medical question. I mean, I can
tell you, a medical question.
I can tell you what we found in our focus groups, but you know, go ahead.
Okay, sounds good, Jacqueline.
So that markup study was very interesting. So just bearing in mind that the Citizen Browser Panel, which was done with a small amount of Facebook users, about 2,500 across the country, it does represent a small fraction of Facebook users in the US and skews a little bit older and whiter than the general population. So, but still, only 3% of Black people on the panel were shown information from public health agencies in comparison to other racial demographics, right? So Facebook has claimed to remove ad targeting by race and targeting in 2016 to 2018, some housing discrimination ad was coming up on Facebook, right? And there was a lawsuit, and they claimed to have removed things which was race-based ad targeting after that. But this is really dangerous because these findings show that the algorithms are not putting the COVID-19 vaccine information in accurate, reliable sources in everyone's feeds, right? And so something like this can be really detrimental to those in communities of color who are acting on a wait and see kind of method as far as obtaining a vaccine. So if they're not receiving the same information as white users, I think that this could be really detrimental to them maybe being pushed over the edge into, hey, like I would possibly take this vaccine. I got this note from the CDC or the WHO, and now maybe I will read it. I mean, I think a lot of us read our ads. I just bought a bed set from one of my ads. So like I click on those ads. So I feel like, you know, people, if they're coming up in your feed, you're going to, you know, maybe check them out. It's going to somehow play into like what you're seeing. So.
Absolutely.
Yeah. And I'm not going to, I mean, obviously it's not my job to say what role social media should have. I mean, we know that they're a big culprit in this, but we're finding out from focus groups. I mean, even before social media, a lot of the smaller communities, you know, it's very targeted media from small ethnic newspapers, small radio stations. That's where a lot of the information. And now what happened with social media, it's, you know, you can't say like WhatsApp. It's certain WhatsApp groups that are all in that thing. They keep, it's like a circular thing where they keep getting the information. One passes the same thing to the other that passes. It becomes a self-serving truth because of that. And that's what we're finding out in the focus group. So, you know, just like we used to do and put ads in the ethnic media, put ads in the little radio station, we still doing, you know, we have like now a contract with one of the stations in Little Haiti in Creole. That's good. But in social media, we're going to have to find a way to get through. And you know, unfortunately, you know, we haven't found a good way, at least I could tell you in our group, how to get to those ethnic, smaller social media enclaves that seem to circulate. And that's something we're going to have to do a better job of, because it is, I can tell you, it's almost all through social media, what we're hearing, where people are getting this information, this wrong information from.
No, and I appreciate you mentioning the WhatsApp. I mean, WhatsApp has been a beautiful, you know, addition, and we saw the use of WhatsApp groups and people's organizing in a lot of different ways more recently. However, as you're pointing out, these nice little close-knit, you know, community opportunities for folks to just be able to engage and share information. Unfortunately, because of the way some of the information, particularly around the vaccine, is being targeted at folks, does also proliferate through there as well. I mean, this also came up in the context of some of the misinformation around the election last year. I know I have friends who raise, you know, some concerns about their own WhatsApp groups that they're a part of. So I do appreciate you you know, mention that, but I think it's also so important to have conversations like this and to have people who are, whether you're journalists or just folks who are just avid, you know, information sharers. I think Nora Benavidez with PEN America actually talks about all of us understanding our role when we're posting as more like individual publishers, because when we're putting information out there, because of the way social media works, we are publishing, you know, our opinion, our fact, whatever it is, and it can be taken as, you know, a certain weight by the people who follow or friend us because of who we are in our relationships to them. And that's something that we should just understand and how we're sharing when we are sharing things. And I think the same thing would apply to even these types of smaller, if you, whatever the group chat is you're in, if you're on WhatsApp or not. But this is also something to consider, I think, with media reporting, that really having more authentic engagement with people who are, you know, a part of communities that are going through these experiences, and not just simply a top-down approach on, oh, this community has mistrust because of this thing that happened, but really starting to engage with people more, like the two of you have both shared, about what it is to have trust, where that trust can be developed and built, and really see itself as more of a helper in moving us forward in this battle against vaccine misinformation. So really just want to remind folks real quickly too, that if you have questions, you can drop the questions in the Q&A. And I am, you know, I see them. So go ahead and ask your questions, because we are a little more than halfway through our conversation for today. And so we just had a comment, not really a question, that just said, thanks so much for mentioning how advertising and ethnic media can be a way to spread accurate information. And yeah, I mean, I think people often overlook, right? Even whether we're talking about politics, whether we're talking about public health, I think people often overlook the importance and value of these smaller media outlets and the roles they actually do play in people's, you know, individual lives. So just, you know, still continuing on our conversation, and we've talked some about, you know, historical issues around mistrust and, you know, distribution and vaccination deserts, and the role that misinformation itself can play in building confusion and distrust. Like, where do we go from here? Like, where do we go? Like, what are the steps that are taking us forward? I mean, things are starting to work themselves out. They're starting to get better, at least in terms of vaccine distribution. But how do we help, you know, shift so that we're not just redoing the whole thing again whenever the next crisis happens? And whoever wants to start.
And it's harder. I mean, it's a political, it's not really a healthcare question, but since I do a lot of my work pre-COVID was on health disparities. I mean, in the medical circles, we use this term called the social determinant to health, that basically says the reason that minorities have worse health status have very little to do with healthcare, and has to do with a lot of the fundamental inequalities in our society. And, you know, many of us are convinced that we're not going to address why minorities seem to have certain diseases more than others until we address a lot of the stuff that's been happening in our community. People talk about things like food deserts, like lack of park. What gets advertised to minority communities? Why is it that, you know, the investments in the social supports that our communities need are much less in minority communities? So very little of it has actually to do with healthcare. A lot of it has to do with fundamental inequalities in how our society is structured. So at the end of the day, it is a political, it's a social and political, it's not a healthcare issue. But we're saying with the next, you know, COVID was not the first calamity. I mean, I just wrote a piece about the hurricane in Puerto Rico and how could, you know, part of the United States kill 3,000 people. It had nothing to do with the hurricane. It was because we had decimated the healthcare infrastructure for the last 30 years. And then when the hurricane came and knocked out what was left and nobody could get healthcare. So it had nothing to do with the hurricane itself or the healthcare system. It was what happened before that left those communities very vulnerable. So, you know, unfortunately, it shifts out a little bit of the healthcare setting into the stuff you guys talk about.
Absolutely. I mean, but I do appreciate that tie-in, and I'll get to you in a second, Jacqueline. I do appreciate that tie-in, particularly just talking about, you know, using the example of Puerto Rico and the hurricane from a couple of years ago, because again, we're talking about this COVID-19 pandemic as if it's just this pandemic. But one of the things that I do appreciate about many of the conversations that have happened around the pandemic is the ability to really critically look at a whole host of other issues. And I think what you were just saying about, you know, systemic disinvestment and decimation of public healthcare, community healthcare, healthcare systems that particularly are serving our communities. And we're talking about, lower income, poor, people of color, Black and brown folks, whatever the euphemism, whatever the framing we're saying, there has been so much of that, particularly in the past few decades. And that's put us in such a critical point. I mean, I saw someone making reference recently to the lack of investment or the loss of community healthcare centers across the country who could have filled in the gap around, some of the public health outreach and informational needs that were necessary to help our communities, work through some of these, challenges and concerns long before the point we're at now. And because, or even just thinking about mass vaccination sites and what it would take for some communities, and particularly in some of these more rural counties that have experienced hospital closures because of various issues. In some areas like here in Georgia, it is directly tied to the lack of Medicaid expansion. So there are these other issues that aren't directly connected to this specific topic, but absolutely play a role in what we're seeing and experiencing. So I definitely appreciate you for raising that point. And so I want to give a quick shout out, and I'm turning over to Jacqueline to answer the second part of this question, or the next question, or you can answer this question specifically and then answer the question that we're about to get to with Shireen. But shout out to Shireen Mitchell, who is an amazing and phenomenal, brilliant, I don't know if this is the right terminology, a scholar, practitioner, but has been, knocking down about disinformation, trolls, folks masquerading as Black women on social media, so much amazing work. So thank you so much for joining us this afternoon. Really appreciate having you in the chat, and thank you for the question. But Jacqueline, do you want to answer this first question first, and then we can get to this other one, or do you want to just get to this other one?
The question about celebrities?
Yes.
Yeah, so thank you, Shireen. Thank you, Anoa. Both these women were very critical in my thesis defense, which was on this topic, but more with election related stuff. So thank you for the question, because it's something I've really been thinking about, right? Influencers on social media attach themselves anytime a celebrity receives a vaccine, talks about getting a vaccine, et cetera. There is a swarm, right, around them of either real activity or troll activity, which are saying that these celebrities are either being paid to take a shot, that they're lying about taking the shot, or much in the case of Hank Aaron, something tragic, a circumstance has arisen from the shot, as did happen with Jesse Jackson, right? So we'll see a lot of, I'm not sure if anyone saw, but recently this week, talk show host Wendy Williams did a interview with Dr. Oz, in which she said that she would not get the vaccine because she did not trust it. I mean, content like this was repurposed, made into composite video with all sorts of text on top of it, and really proliferated across the internet like wildfire. I mean, got an ungodly amount of engagement, reshares, and plays, right? So anytime a celebrity uses their influence to talk about vaccines in a positive way, it is spun negatively immediately. It also happened with Tyler Perry. He did a special on BET in which he really wanted to erode vaccine hesitancy because he said he too was scared, but then he changed his mind. And a lot of this is where a lot of conversations are beginning. I was scared, I'm not, and I want to show my community, look, there's nothing to be afraid of. Let's take this shot, let's do this. But then it has unfortunately spun as into some sort of attempt for these people to get money. I do not think Tyler Perry needs $1,500 to take a vaccine shot, but this is what people try to spin online. So there's a few primary influencers that spread this sorts of mis and disinformation online, right? They're getting the big engagement. Then you have some other people who are confused. Those people are really drawing on those major influencers for what they're getting, right? And they make very harmless memes. We have to think about how we're getting our content. Memes are very successful purveyors of mis and disinformation online, right? Taking these videos and putting little vaccine shots over top of them and little sick emojis and everything in all caps. I mean, this is really, taking a lot of even what was said in a lot of times out of context, right? A lot of these videos are also used to kind of politicize vaccines as well, right? They're used by different kind of political organizations. So I think celebrity is something that we really need to keep an eye on. If there is an attack on a celebrity that you see in some sort of social media comments, or if you see something like this, you really need to be critical and think about why this is being spread, right? Because this is a targeted disinformation campaign.
Absolutely. And be critical of the information. I mean, we saw this, we saw this pre-vaccine with COVID, right? You know, a lot of the stuff about the mask, you know, oh, the mask will lower your oxygen level. You're going to become hypoxic. I'm like, look, surgeons operate in a hospital. They wear the mask 12 hours a day. You don't see their oxygen level drop. You know, put on your oxygen meter, walk around 10 blocks and see if your oxygen. So people got to be a little bit, with the 5G towers, it used to be, you know, the COVID virus was somehow developed to resonate with the 5G towers. And that conversation immediately flew over to the vaccine. So now it was the vaccine somehow, the 5G, and not the COVID. And nobody asked those kind of questions. And, you know, people, you know, we ask police, think a little bit more about what you're hearing, what people are saying, and ask some of the critical questions. Because it really, you know, a lot of the stuff that is out there is just, you know, things that if you stopped and took, it's scary, but take a little deep breath and, you know, it's fairly easy to reality check a lot of this. So.
Absolutely, and appreciate you both for, you know, responding to the question. And thank you, Shireen, for joining us again and asking the question. So we have another couple of questions in the Q&A box. So just for you, Jacqueline, where does vaccine disinfo primarily come from? Is it developed by prominent bad actors, or is it just like some spontaneous grassroots effort? And then are there any particular pieces of vaccine disinformation that you see targeted at BIPOC communities that is especially insidious or hard to debunk? I have thoughts, but we want to hear yours.
Okay, great. I would say the most insidious are the ones that are tied to truth. As far as who's behind these, you know, Robert F. Kennedy does collaborate with a lot of different organizations. Most notably, at First Draft, we just completed a piece on the Nation of Islam and how they are like primary spreaders of vaccine misinformation and disinformation online, right? There's a few influencers as well as leaders that hold, you know, weekly webinars, make a lot of this content that I was just talking about as far as composite videos and memes and spread them across the internet. Some of them are profiting off of these measures. They have a Beyond Tuskegee or Not Another Tuskegee, in which they sell apparel, you know what I mean, and other accessories, right? So this is obviously a very well-planned, well-intentioned disinformation campaign that's being spread by this kind of extremist religious group. So that is something to look out for. What was the second part of the question? There was a second part, right? Let me see.
The second part of the question, just a second, was, yeah, I mean, I think you were talking about I think you gave examples while you were answering about vaccine disinformation that is especially this insidious or hard to debunk.
Yeah, so I think the things that definitely have a grain of truth inside them are hard to debunk. There's other also going on to the NOI, you know, the depopulation comes into it, right? They draw on this meeting that was made between, you know, Bill Gates and several, you know, billionaires saying that that's like a root of depopulation. Okay, this meeting did happen, but that's not what the meeting was about. It was not about depopulating the earth and not depopulating the Black community, but drawing on actual things that happened in order to spread disinformation. A Planned Parenthood can be another target of that, right? So that's why I say celebrities targeting these big sorts of organizations in order to effectively cause vaccine mistrust.
I would just
our focus groups. I mean, it's really amazing. There's conspiracies about the conspiracies now, especially I work a lot with the Latino media. And so they're all obsessed finding out who in Latin America talked to this. In our focus groups, when you ask people where this is coming from, you know, it's Miami. So obviously it comes from Castro. It's the Castro government doing this. Other people blame the Venezuelan government. So this is the Venezuelan government targeted. I don't know, you know, we don't know where these things are, but they really target up in the Haitian community. We heard about the 666, for example, that somehow the vaccine is marking you with 666 so that you can't go to heaven. So we've had a Haitian faith that he explained how that's not consistent with scripture because of all the other signs. In the Latino community, one has really resonated among Latino Catholics has been that they're injecting stem cells from aborted fetuses into you. And so basically these are the products of abortion. And yeah, it did have some of the technology that this was developed on was based on stem cells from a long, long time ago. So there's that little kernel. So we had a priest basically explaining to people why that doesn't make sense and that's totally not rational, but they know exactly how to come after. I mean, they know exactly the inflection point and what to do. And while we don't know, obviously other people are doing lots of good research where it's coming from, but we know that they know exactly what to say and how to target our communities with exactly what they know is gonna, is their inflection point for them. So these are very sophisticated campaigns.
I appreciate that. They are very sophisticated campaigns. And just in addition to those, I mean, I think one thing, Jacqueline, that also sticks out with me specifically with the Tuskegee comparison, since that's like, I guess, the most well-known one that we keep hearing about, is that people often don't really know what happened with Tuskegee. It was the fact that people were left untreated for multiple groups of people over several decades were never treated for syphilis. Not that it was given to them or that, they were getting like people thought they were getting treatment, right? So in this instance, it's not that you're not getting treatment or we're giving you a fake treatment. Like there's a very real vaccination that is really being given to everyone, across the board. I do know that there have been some concerns about just the differences. And I think maybe Dr. Carrasquillo, you could talk to this, if there are valid concerns in the differences between the Johnson & Johnson vaccine and the Moderna and Pfizer ones, and concerns about equity in terms of who gets which version of the vaccine, because then that also has led to, I'm starting to see some hesitancy or concerns from folks about like who gets to get which one.
Yeah. And the message, as everyone keeps saying, is the right vaccine for you is the one you could get today, because we still have a very scary epidemic. We know all three are very effective. The Johnson & Johnson was tested when we had all these other variants out there, right? So we found out it was 50% effective against the South African variant, but that's over getting mild COVID. It was 100% effective against severe COVID. And me as a doctor, what we call severe is the COVID that takes you to the hospital. That's what I want to protect, whether somebody gets a mild case or not. But we know that all three are very effective. It's with the Johnson & Johnson, there's a slightly higher chance that you get asymptomatic COVID in the first month. But even after that, after the first month, it's just as protective as the others. So I think it's, one of these things where people play off our fears and play off our insecurities. And what's important is that we get any vaccine. Some people like J&J because it's only one shot and it seems to have fewer side effect profile. But at the end of the day, it's whatever vaccine you can get. That's what's important.
Thank you. Our next question, and Dr. Carrasquillo, I'll start with you for this one. So this next question, and I'm a paraphrase because I don't know how much, being in Florida, I don't know how much you know about vaccine rollout amongst Native Americans in Oregon. However, the idea that, the tribal health clinics were able to have their own and run their own vaccination process. The question has to do with whether or not this is a model that can be recreated for other communities if you actually have like a community-based entity, I guess, that could then roll out its own vaccination process. Is this something that could help address some of the disparities?
Yeah, but it's got to be people that have operational experience doing this, right? And that's one of the challenges. In Florida, when the governor said, well, the hospitals provide healthcare, they'll know how to do this. The hospitals have never run mass vaccination campaigns. So it has to be logistics. I think you got to work with the community partners in setting up these sites. Community partners are really good at telling you where you should have them, what hours you should have them, and what kind of messaging and advertising you should be about them. But some, not everyone knows how to, overnight set up a mass vaccination clinic. So you need some of that logistical expertise as well. So it's a combination of both, but certainly working with the community partners in some way is important.
Absolutely, thank you. And so, sorry, I was just trying to do a little housekeeping, get clarification on another question. And then just thinking as we're closing out, because we are at 12:52 and we are almost at the end of our hour. Tears, but this has been a really great conversation. And as much as I have thought I have known about this topic, I have definitely learned quite a bit from talking with the two of you. And I hope folks viewing have also learned some valuable and useful considerations and have new questions now to ask as well. So just thinking about just how do we get at the root? So we have a question here and it says, I know we touched on this somewhat, but I think Jacqueline, they want you to repeat the organizations or some of the groups you were naming around those who are kind of like purveyors of disinformation. And if either of you have any thoughts on like the why. I mean, I don't know why people are chaos agents personally. I also don't spend a lot of time trying to think about it, but maybe, especially with your research, Jacqueline, you have different ideas.
I mean, there's various reasons. One of them that I named is economic. Economic is always a good reason to spread mis or disinformation. We can also go with fame or celebrity, right? And attention getting. That could be another reason. There could also be some people who truly believe, have anti-vax sentiment and have been on the internet since the dawn of the internet, right? Who's to say? But really, I think that some of the drivers are, yes, I did name NOI as a main driver. That's an organization that I can think of. We all know, or now we know, Robert F. Kennedy, as far as like a driver, he has been deplatformed for the most part, I believe. And it seems that the platforms are making moves to get some of these people offline, right? But as a researcher, what I'm really meant to do is like a conduit and kind of make sure that this sorts of information doesn't, erode trust in vaccines, right? I'm not sure if we'll ever get to the bottom of it. I kind of say, like, how do we get to the bottom of this and get it out from the root? It's very difficult, right? Because when these people realize that they've gone a little bit too far to where they may become deplatformed, they draw it back a little bit, they can come on different, they can use their vehicle to go through other people's platforms. So it's really difficult to get rid of, right? So this is going to be a lot of tech accountability, tech reform, before we get to a place where we can like really get, disinformation out of the root. It's a lifelong process. And this is why there's so many jobs and people devoted to, getting healthy information out in the ecosphere.
And rather than, what are the groups we can trust? I think the question is, who can we trust, right? As I tell everyone, talk to your doctor, right? I mean, everyone that has a doctor, talk to your doctor, see what they think about these issues, right? Most of us will steer you right, but there's also a lot of trusted health information sources out there. National Institute of Health has spent a lot of time and money to create a lot of information for the public. The CDC, even at the worst days under other presidents, most of what they had out there was really good. Our Department of Health, is over a governor who has been problematic, but throughout the whole epidemic, most of the information on their website was pretty good as well. And then there's local departments of health. Those are probably less politicized. So they are trusted sources of information. Your doctors and, the formal public health agencies that are in charge of these things have done a pretty good job throughout the epidemic of providing pretty good information. And that's where you should be getting your health information from. And again, not from, your cousin's brother's friend who posted something on Twitter this morning, So that's what I tell people. Don't think of, why they doing it. Think of who should I trust.
Absolutely. Thank you both. And so as we're closing out, I just would like to give you both the final word. We'd love to hear more about what you're either working on now or what you're working on coming down the pipeline.
Coming down the pipeline. So people always asking me about, long-term about these vaccines. Everyone that we're following up gets followed up for 2 years. We just had another call this morning with, the pharmaceutical company, Johnson & Johnson. And they want to know everything about what happens to people over the next couple of years. So we're collecting all this really good data. We have data going back from July. So we have, people are like, oh, this is new. No, we started these studies in July. We have good data, a lot of the side effects going back several months, and we will continue to do that. And the other thing is that if we all get vaccinated, we'll be out of this in time for Thanksgiving and Christmas. No one wants to spend the same Thanksgiving and Christmas we spent last year with the social isolation. So there's a light at the end of the tunnel. Our kids will be going back to school, but we got to make sure we all get vaccinated. And that's the important thing right now. And we'll follow these people. And we know everything possible about these vaccines over the next several years.
Yeah, so as far as next steps, continue to work with grassroots organizations, CBOs and NGOs, and bring them together with newsrooms. We all know that newsrooms are not representing the communities they are meant to serve, right? Because of lack of diversity, right? So the only immediate solution, considering it's a systemic problem, is to bring groups together who are on the ground, who actually work with communities that are BIPOC, right? And have diversity in order to get, healthy information and articles out into the media ecosphere, right? Trying to talk less about historical legacy, not less about historical legacies, but making sure we talk about access and equity versus, always using buzzwords such as, Tuskegee, perhaps, right? Henrietta Lacks and things like that. Really, let's talk about the fact that, people are being denied vaccines in certain communities, that people want vaccines in Black communities, right? That actually distrust is higher among conservatives, white conservatives, than it is among Black people and minorities in general, right? So let's get that real information out there. So I will continue to work on that in the coming year, and let's get everybody vaccinated.
Yeah, and post-COVID, going back to all the social justice issues that are always important. I've been a big advocate of universal health care, and those are the issues once we get through this, we got to go right back to, and the things we normally advocate and fight for.
I appreciate a universal healthcare, a doctor who is not afraid to put the issues out there. So thank you so much, both of you, for this conversation, for taking time. And thank you to everyone who joined us this afternoon for this conversation. And take that link. And this is something that's good that you should share. Definitely share it. Tell your friends, tell other folks, tell your colleagues about it. And again, I'm Anoa Changa. I'm just a journalist out here trying to help spread the good word. And I'm going to turn it back over to Nora Benavides with PEN America as we close out this hour-long lunch. It's kind of like a lunch chat. So thank y'all.
Well, I in no way want to labor over the goodbyes, but this was amazing in no uncertain terms. As someone who thinks about these issues daily, I just felt really moved by both of your commentary and Anoa, you shepherding us through this. At PEN America, there was something that the doctor said, that there is no monolithic way that communities think about these issues. And we take that very much to heart in how we work with communities. And so over the next several months, we will continue these types of conversations, hoping to do breakout listening sessions, community organizer trainings, work with faith leaders, with educators, librarians. It was really quite a treat that we had experts like this with us today. The other piece of the work is the everyday people that we all know and love that come to us with questions. And so we will be bringing tools and techniques on how to use media literacy to combat the spread of this type of misleading content, and to help all of you who are here today on how to talk with your communities. I think that trusted messengers are key, and we firmly believe that people like Dr. Carrasquillo and Jacqueline Mason and Anoa Changa have such a powerful role to play. So giving them the space to do what they do and to talk about it has been so wonderful. And we look forward to more with all of you. We've put in the chat one of our tip sheets on how to recognize COVID disinformation. And so I hope you check that out. We also have listened to what communities say. And the number one question we get is, how do I talk to someone I know or love about issues when they believe something misleading? And so we've put together and shared in the chat a guide on how to talk to friends and family. I think we have to always bring empathy. We have to bring our own anecdotes. And so we're eager to do more with all of you. Next week, we'll be hosting a listening session with community organizers in South Florida. So if you are tuning in because of where you are, please stay tuned for more information on that. It's how to work with organizers to embed so much of what our experts here today have talked about. And we look forward to seeing you again. So thank you all so much. Thank you to our sponsors and our partners in this. The Racial Equity and Journalism Fund is always a partner of ours, and so fantastic in bringing journalists here to listen. First Draft, which is, I think, in every way, one of our most favorite groups because of the collaboration. Anoa, Dr. Carrasquillo, Jacqueline Mason, thank you all so much.
Thank you. It was a pleasure. Thank you very much.